Hello, and thank you for being with us today. My name is Emma Watson, and I'm the Pennsylvania Government Relations Director to the American Cancer Society Cancer Action Network. You can find a link to the press release for today's event in the chat box. Today, I'm joined by patient advocacy and provider groups alike to highlight an issue that impacts cancer patients along with individuals living with a wide range of chronic diseases and conditions. Prior authorization and step therapy, also known as fail first, can undermine a physician's ability to effectively treat their patients. Patients need the ability to quickly assess their conditions with their medical professionals and find the best course of action for their individual health needs. Removing barriers to timely and affordable health care, particularly during the COVID-19 pandemic, is critical to ensure that every individual can receive the necessary care they need. Delays in access can pose significant risk to the treatment of disease, as well as adding debilitating anxiety as the patient and their family is forced to wait for the appropriate treatment. Patients deserve timely access to care. It is my honor to introduce the Honorable Senator Kristin Phillips-Hill, serving York County, champion and sponsor of Senate Bill 225. Senator Phillips-Hill.
Good morning, and thank you, Emma. It's an honor to join all of you this morning, and I want to offer our gratitude to all of the healthcare providers who are participating in this virtual press conference today for being on the front lines of this pandemic and taking such good care of Pennsylvanians under very challenging circumstances. I'm Kristin Phillips-Hill, and I have the honor of representing more than 250,000 York Countyans in the Senate of Pennsylvania. In fact, it's great to have one of the leading advocates of this much needed legislation and fellow York Countyan on this call as well, Dr. Suzette Song, who you'll hear from shortly. As the prime sponsor of Senate Bill 225, this legislation will not only streamline, but also standardize the process for prior authorization of medical services here in Pennsylvania. And when we talk about prior authorization, we are referring to the process by which physicians and other healthcare providers must obtain advance approval from a health plan before a specific procedure or service is delivered to the patient in order for it to qualify for payment coverage. Patients all across Pennsylvania find themselves subject to significant delays in receiving much needed treatments because of our current laws and an existing patchwork approach. And what Representative Steve Mentzer and I are proposing is to bring our medical care into the 21st century. As Emma said, this pandemic has shown how far we can push technology to provide the best quality care at a reasonable cost and use new models to drive healthcare. This patient-centered approach will improve transparency for patients and providers alike and bring consistency to an inconsistent process that has plagued those seeking healthcare treatment options for far too long. A key element of the bill will be the development of a standard prior authorization form that can be electronically submitted by all healthcare providers and accepted by all health insurers. And that's why we have strong bipartisan support for Senate Bill 225. Republicans and Democrats working together on a patient-centered initiative will standardize and provide consistency that patients and providers are seeking. And we want to see patients get the best possible treatment available, recommended by their physician. And this bill removes the fail first model that in this day and age seems rather archaic. We have seen that the step therapy model that sets patients up to fail first, to try prescription drugs to treat chronic conditions, oftentimes that are not in the best interest of the patient or their doctor. And there really is no excuse for that in 2021. This leads to poor outcomes, higher costs, and very frustrated patients and providers. Studies have shown that patients grow frustrated and they abandon their treatment plan altogether. And this ultimately will increase the cost of healthcare when a patient walks away mid-treatment. Through Senate Bill 225, we cut down on wasteful spending, we can improve response times, and we can allow providers to practice and patients to be treated based on the advice of the practicing medical professionals. And this much needed reform brings patients closer to their providers. I really appreciate the opportunity to say a few words about why we need Senate Bill 225, and we'll turn it back over to Emma for the introduction of our next speaker. Thank you.
Thank you, Senator Phillips-Hill. Now it is my pleasure to introduce the Honorable Representative Mentzer, serving Lancaster County, champion and sponsor of House Bill 225. Representative Mentzer. I'd like to introduce Dr. Tracy Conti, Program Director of Family Medicine at UPMC McKeesport and President of the Pennsylvania Academy of Family Physicians. In addition, she also serves as Vice Chair and Assistant Professor at the University of Pittsburgh School of Medicine. Dr. Conti is committed to the pursuit of excellence in academic medicine. She has been recognized for her clinical contributions, including being named a Pittsburgh Top Doctor, a Pittsburgh Top Black Doctor, and was recently named the 2019 Gateway Medical Society Physician of the Year. Dr. Conti.
Difficulties. I am Dr. Tracy Conti, President of the Pennsylvania Academy of Family Physicians. Thank you for inviting me to speak on behalf of our nearly 6,000 physicians, residents, and student members, and our patients. While prior authorization delays and step therapy protocols can be an administrative nightmare for physicians, it is nothing compared to the impact on our patients. Let me share some statistics. In a 2018 study of Pennsylvania family physicians, the PAFP found that prior authorization results in delays in patient care 98% of the time. Let me repeat that. Prior authorization delays patient care 98% of the time. According to a 2019 study from the American Medical Association, 24% of physicians report that prior authorization has led to a serious adverse event for a patient in their care, while 16% report that prior authorization has led to a patient's hospitalization. Further troubling, 74% of physicians in the same study report that their prior authorization can at least sometimes, if not always, lead patients to abandon their recommended course of treatment. This can lead to devastating consequences to a patient's health, and that is completely unacceptable. Imagine being a patient recently diagnosed with diabetes. Now imagine having to wait days or weeks to receive the crucial care needed to treat your illness because your insurance company has determined that a decision by your physician for your course of treatment needs to be authorized by someone who has no knowledge of your health history or current health needs. Meanwhile, you wait anxiously to begin that treatment, and at the very least may improve your quality of life and very may well end up saving your life. Unfortunately, this happens all the time. A personal story is, we have to obtain prior authorizations not only for medications, but for radiology tests and in-office procedure and patient equipment. I have a patient that has a rare form of diabetes, latent autoimmune diabetes of adult onset. This requires her to check her sugars multiple times a day, more than a regular diabetic. Every year, I have to spend hours justifying her diagnosis, her supply needs, like her insulin pens, her testing strips, and her insulin testing needles, in addition to her medication. This is not only an inefficiency for my office and for my staff, but it increases my patient's anxiety about her condition and has caused delays in her receiving the insulin that she needs. She's concerned that whether anyone is really truly concerned about her and her specific illness. This story is not unique, and unfortunately, patients and physicians across Pennsylvania have had similar experience. This needs to stop now. The simple reforms outlined in House Bill 225 and Senate Bill 225, such as giving providers access to more efficient electronic prior authorization systems and establishing turnaround times for prior authorization decisions, will go a long way in ensuring that patients are receiving the care they need when they need it, determined by their physician, not their health insurance company. Let us be clear, this legislation does not prohibit insurers from utilizing the prior authorization process for prescription drugs or services, nor does it prohibit insurers from using fail-first protocols or limit the number of allowed steps. We physicians understand the need for cost savings in our healthcare system as well as anyone. The legislation simply provides for more transparency and consistency in the prior authorization and step therapy process to accelerate appropriate patient care. 27 other states have adopted some version of prior authorization reforms like those outlined in House Bill and Senate Bill 225. And additionally, 28 states have adopted legislation to allow physicians to override a step therapy if the required drug would cause harm to a patient, is expected to be ineffective, or has already been tried under a previous health plan. It is far time for Pennsylvania to do the same. By adopting the reforms in House Bill and Senate Bill 225, we can help ensure timely, quality patient care, which may ultimately lead to improved health outcomes for more Pennsylvanians. Thank you, Senator Kristin Phillips-Hill and Representative Steve Mentzer, for understanding the enormous impact that prior authorizations have on patient health and taking steps to help make the process more efficient, consistent, and transparent. I would encourage all members of the Pennsylvania General Assembly to support these important reforms. Thank you.
Conti, and I want to apologize for technology difficulties this morning. We have the Honorable Representative Mentzer with us, serving Lancaster County, champion and sponsor of House Bill 225, and would love to give him the opportunity to speak now. Representative Mentzer.
Can you hear me?
We can.
Oh, okay, great. Well, it's a pleasure to be here, and thanks for inviting me. Senator Phillips-Hill pretty much summed up exactly my sentiments. And so once again, I'd like to introduce House Bill 225 to ensure that patients and doctors have a more efficient electronic prior authorization system. The bill should expedite the prior authorization process, reducing administrative burdens for physicians and ultimately better serve patients, as the senator said. The bill ensures that fail-first protocols are based on clinical guidelines developed by independent experts, and establishes a basic framework for when it is medically appropriate to exempt patients from the fail-first protocols, and makes those exceptions transparent and accessible to patients and providers. I believe this legislation can be a priority in this two-year session and will work hard to do so. The current pandemic is a perfect example of why we need to ensure providers and patients get care as quickly as possible. So thank you again for having me.
And thank you for being with us today. Now I would like to introduce Karen Jury. Karen is an active leadership volunteer with the National MS Society. She has been living with MS since 2008 and is a breast cancer survivor. Karen lives in York, PA with her husband and her 4 children. Karen.
Good morning. I'm Karen Jury, a wife, mother, and a volunteer with the National MS Society from York. I'm happy to join you today to discuss my MS story and how prior authorization and step therapy has impacted my health over the years. My journey started in 1997 when I was 26 years old and began experiencing symptoms. But at the time, I was told I had multiple sclerosis-like symptoms, but because I had no plaque lesions on my brain, I was not officially diagnosed. In 2008, less than 1 year after my 4th child was born, I began having tingling in my hands and also experienced a flushing or shock-like feeling in my body every time I raised and lowered my head. An MRI was ordered. The lesions on my brain lit up at that time like a Christmas tree. And in 2008, at the age of 37, with 4 children, ages 2, 4, 6, and 9, I was officially diagnosed with relapsing remitting multiple sclerosis. What happened next was the beginning of 13 years of dealing with a chronic disease and feeling misunderstood and constantly petitioning for help by doctors, insurance companies, and spending countless hours completing paperwork and making phone calls, all while continuing to work and raise my 4 children. No one in my family had this disease before me, and I knew virtually nothing about MS or the treatment options. I had no idea at that time that my insurance company would be dictating the treatment I was given. My insurance company utilized step therapy protocols, and therefore, my doctor prescribed medications based on what my insurance would cover. I failed the first drug my doctor had to prescribe to me, as it was the first drug in my insurance company's step therapy protocol. The treatment consisted of injections 3 times per week, which I mustered through tolerating for 6 months. During those 6 months, the day after each injection, I was bedridden with flu-like symptoms. If that wasn't bad enough, I was trying to do this while taking care of 3 of my 4 children who were not in school yet. After 6 months, I couldn't tolerate this drug any longer. These 6 months were very stressful and negatively impacted my health and my personal life, especially my marriage. My doctor then prescribed the next drug my insurance would approve, which was effective for about 2 years until I began to develop golf ball-sized injection site reactions daily after administering my shot. While I did ultimately fail on the second drug, I was stable for a long time on it, and I wish I had been able to initially start on this drug and not have to endure 6 months of harsh side effects, which eventually negatively impacted my liver function. After failing on 2 drugs, I decided to take a break from treatment for a period of time. In 2013, I was diagnosed with breast cancer and spent a year fighting the disease. I'm happy to say that I am in remission and cancer-free since 2014. In 2014, when an oral drug became available for MS, I decided it was time to start treatment again. Having been able to prove my failure on the other 2 drugs, I was able to start this one. However, that did not mean there were not hurdles to access this medication. From January 2015 until August 2020, I dealt with prior authorization issues each time a new calendar year started. I spent hours on the phone with doctors and insurance companies to get prior authorization for a drug I was already on and continued to be for 6 years. My medication was delayed by as much as 6 weeks at the beginning of a new calendar year due to the maze of calls I had to make to continue to stay on the same medication. It did not matter how much I tried to do ahead of time to alleviate this lapse in coverage. It has happened to me every year since January 2015. No one should have to work this hard to access a treatment that is standard treatment for their disease, is prescribed by their physician, and is working for them. I started my 4th MS medication in October. this past October, at which time I made all the necessary calls to everyone involved so I wouldn't have a lapse in coverage or medication delivery in January of 21. My new MS drug was delayed until mid-January. When I asked what the problem was, you guessed it. The insurance company wanted prior authorization, which I had already obtained in October of 2020. I hope that no Pennsylvanian has to go through the stresses that I have to access their medications. That is why I am here advocating for this legislation. I want to thank Representative Mentzer for his support of this legislation, and I particularly want to thank my state senator, Kristin Phillips-Hill, for leading efforts in the Senate. As a constituent living with MS, I cannot thank you enough for your support.
Sharing your powerful story. I would like to introduce Dr. Michael Delava, a combination ophthalmologist, pathologist, and biomedical scientist from Philadelphia, who also serves as president of the Pennsylvania Medical Society. He has a diverse professional background with practice in private, group, corporate, and academic settings. He served several U.S. patents and has been a consultant to the FDA and NASA. He also served on Philadelphia Med Studies opioid treatment. Dr. Delava.
I thank you for the opportunity to speak today on this very, very important topic. As president of the Pennsylvania Medical Society, I represent some 21,000 doctors, medical students, fellows, and residents across the state. And we are uniformly in favor of updating prior authorization through the support of the legislator as proposed here. We have been around for a long time. We've gone through the Civil War, we've gone through 2 world wars, and actually we are into our 2nd pandemic now. And throughout our history, we strongly advocate for the patient. The prior authorization is bad for the practice of medicine and for the patient, as the previous speaker so definitively defined a situation. And what we find is that so much of our time is tied up with prior authorization, which yields a not good result anyway. In an extensive study by the AMA in 2019 of over 1,000 physicians that included primary care physicians and specialists, they found that some 20% of their practice time was tied up trying to get prior authorizations. Imagine that. If we did away with prior authorizations, you would have 20% greater healthcare capacity in this country. And the other problem with it is when that time is poorly spent, the results in over 90% of those efforts yield delay in patient treatment. We can give you case in point where we know the tests that have to be ordered, such as an MRI to get the definitive results for which we are trained as primary care physician and specialist. But we are denied this. The patient has to go through other tests that are not definitive to the point where we absolutely need an MRI, and it may further be denied. As an ophthalmologist, we have many situations with the newer drugs, which are remarkable. The technology is coming out today. We have drops that can prevent the blindness of glaucoma to a great extent, but we have to go through prior authorization and often denial. And they tell us, as an alternative, keep the patient on a previous drop, which we know has failed the patient. Okay, so why jeopardize their health? Why jeopardize their vision? And that, unfortunately, is part of the equation, which the people who are promoting prior authorization do not realize. What is the cost of disease What is the cost of death? What is the cost of disability? And so we are strongly behind your efforts to modify prior authorization, both for the practice of medicine, but for the good and well-being of the patient. I thank you for this opportunity for speaking, and I hope to work further with everyone to push this over the goal line for the better care of the patients. Thank you.
Thank you, Dr. Dellavecchia. Now I would like to introduce Samantha Ryan. Samantha is a patient advocate with the Crohn's and Colitis Foundation. She is originally from Tioga County and is currently living in Selinsgrove with her husband and daughter. She was first diagnosed with Crohn's in 2012 and continues to battle the disease. Samantha has been volunteering with the Crohn's and Colitis Foundation since 2017. Samantha.
You today. I am Samantha Ryan. I'm here to speak with you all today regarding my personal experience with insurance-mandated step therapy, also known as the fail first method. At the age of 20, I started getting sick while pursuing my college degrees, and it was not until after I turned 21 that I started to understand why. I was diagnosed with Crohn's disease, a type of inflammatory bowel disease, or IBD. IBD is an autoimmune disease that attacks the GI tract. Unfortunately for myself and the 3 million other Americans that live with IBD, there is no cure. I thought living with a chronic illness in my 20s was hard. Not just the physical impact, but the mental impact of knowing that I was living with a disease that I would have for the rest of my life. But little did I know that it was only going to get worse. In 2015, my Crohn's disease took a turn from mild to severe. I was naive back then, and I had no idea that my insurance company had more control over my health than my team of trained doctors. My gastroenterologist wanted to put me on a biologic medication that had shown great results in many others with similar severe disease progression. After almost 3 weeks, my insurance company came back and said that I needed to try and fail steroids and prove that steroid therapy alone would not help my case. So I had to do 6 weeks of steroids and expose myself to another CT scan just to prove to them that steroid therapy did not help me. And after we submitted that proven failure, another few weeks went by, and then they came back saying that I needed to try yet another medication before the original one prescribed would be approved. The thing with biologic medications is that they take a while to build up in your system, and it can take anywhere from 3 to 6 months to truly see their effect and see if they're going to help you. After about 2 months on the medication that insurance was requiring me to try, I ended up having an allergic reaction to it, and I had to stop it immediately. But even after that, it still took another few weeks for my insurance to finally approve the original medication. At this point, I had been flaring uncontrollably with no relief for nearly 8 months. I had made multiple trips to the emergency room, and my intestines were getting more and more damaged every single day that I went without the proper treatment. And even after I was finally on the correct medication and my symptoms were not as severe, I had so much scar tissue built up in my intestines from those months of constant inflammation that my food was passing through an opening the size of a straw. This resulted in recurrent bowel blockages unless I was on a strictly liquid diet. Due to the narrowing from the scar tissue, I ended up needing surgery to remove 12 inches of my intestines because the damage was just not repairable. And unfortunately, I am not alone. I am one of thousands of stories from patients throughout the state of Pennsylvania that have experienced a significant delay in their care and have experienced a negative impact on their quality of life. Had I been given the medication that my doctor wanted me on originally, I truly believe that I could have avoided surgery. And that is why I am so passionate about advocating for step therapy reform. Patients like me should not have to wait weeks for an answer from their insurance company that a medication is being denied. Patients should not have to try and retry an already failed medication just because they switched insurance companies. And patients should not have to go through these types of situations and jump through hoops just to get the medications that are going to help their quality of life. I really hope that you will strongly consider supporting this bill to help patients like me. Thank you.
Thank you, Samantha, for sharing your powerful story and for being with us today. Now, I would like to introduce Dr. Suzette Song. Dr. Song is a board-certified orthopedic surgeon and is the Vice President of Medical Affairs for OSS Health in York, PA. A true Pennsylvanian, Dr. Song grew up in Greater Pittsburgh, is a Penn Stater, and received her medical degree and training at Jefferson Medical College and Jefferson University Hospital in Philadelphia. Dr. Song is also a board member and officer of the Pennsylvania Orthopedic Society. In those roles, she advocates for patients and physicians at the state and federal levels. For the past several years, Dr. Song has been battling excessive healthcare insurer prior authorization processes in the state capitol. She is extremely pleased that her good friend, Senator Kristin Phillips-Hill, has agreed to sponsor Senate Bill 225 this session. Dr. Song.
Thank you, Emma. Good morning, everybody. Let's start with a quick civics lesson. So each session of the Pennsylvania General Assembly is 2 years long, right? January of 2021 marks the third legislative session in which Pennsylvania patients and physicians have sought to rein in healthcare insurers' excessive pre-authorization processes. 4 long years ago, at the start of 2017-2018, our legislation was first introduced. We thank Senator Phillips-Hill and Representative Mentzer for their perseverance in this vital battle for patients. We must succeed in this new legislative session. In orthopedics and in many other specialties, care delayed due to treatment pre-authorization is care denied. You've heard it expressed so eloquently and personally already this morning. Also, the pre-authorization requirements for physical therapy prior to orthopedic surgery can be detrimental to a patient's well-being and their ultimate recovery. We see this every day. Every day, my physician colleagues and I fight on behalf of our patients to vindicate their right to the proper care that an insurer has already received premium payments to provide. Remember what Dr. Conti said earlier, 98% of the time. Fortunately, in most cases, we eventually win the battles to provide medically necessary care, but why must we engage in these daily conflicts? Physician practices continuously clash with healthcare insurers to enable patients to receive the care they need and for which the insurers were paid. This must stop. Excessive pre-authorization adds to the cost of care, may diminish patient outcomes, and only lines the pocket of third-party administrators who have a profit motive to deny care. House Bill 225 and Senate Bill 225 will stop these practices. This legislation must be enacted by June. Listen, we're all painfully aware of the legislative dysfunction in Washington, D.C., but here's some news. In the waning days of the 116th Congress and the Trump administration, long-sought legislation subjecting healthcare insurers to the antitrust laws that all other industries deal with cleared the Congress by bipartisan vote and was signed into law by President Trump on October 13th. This vital law will begin to level the playing field between healthcare providers and the insurers. And its enactment came on bipartisan votes following the most contentious election in memory. As a physician advocate who's worked the halls of Congress and our own state capitol, I'm amazed that the federal government took on the insurance industry and in a bipartisan manner enacted significant legislation to benefit patients and physicians. It's time for the 205th Pennsylvania General Assembly to come together and do as well for their constituent patients and physicians as the 116th Congress did. Thank you for hearing us out today. Please make this happen. Thanks.
Thank you, Dr. Song. I want to thank all of our speakers and advocates for being here today. You heard powerful examples which highlight the necessity for balance between cost containment and patient needs. Our efforts to engage lawmakers on the issue begin now. In the chat box, you'll see a link to contact your state lawmaker and ask them to co-sponsor this important legislation. We look forward to working with Representative Mentzer, Senator Phillips-Hill, the General Assembly, and the administration to improve patient access to care. Thank you again for being with us today.